back, viewers. You're still watching a Good Life, the health show with me, Pooja. Well, viewers, earlier I spoke to Dr. Rifat Mannan, who was featured among 100 top pathologists in the world. And presently, he's an assistant professor of clinical pathology and laboratory medicine at the University of Pennsylvania's Perelman School of Medicine in the United States. And incidentally, Dr. Rifat Mannan hails from Assam. Let's listen into the conversation. Hello viewers and welcome to this special segment of your show Good Life. Well, viewers, nominated for his excellent teaching and inspiring mentoring of residents, he's assistant professor of clinical pathology and laboratory medicine at the University of Pennsylvania's Perelman School of Medicine. Well, I am talking about none other than Dr. Rifat Mannan, who has several years of diverse experience, especially in pathology. So not to waste any more time, I'll straight away move to Dr. Rifat Mannan and talk more on the topic and talk more on his career-related topics. All right, thank you so much, Dr. Rifat Mannan, to coming for a good conversation and a fruitful conversation. So I would just like to ask, and I'm pretty excited to talk to you as well, and I'm sure the viewers also must be very excited to see you in Good Life show. So my first question to you would be that tell me something about your job. And our viewers also must be excited to know that.
Thank you, Pooja, for having me today on your show. I have heard a lot about your show, but it's the first time that I got the opportunity to be here in person. So
my pleasure.
Thanks a lot. Thanks a lot for having me here. So and thanks also for your kind intro. So you are asking about my current job. So, and as you say that I'm a pathologist. So, and I work in the University of Pennsylvania. So interestingly, I would like to add here that the hospital that I work is actually the first hospital that was established in the US. So it was established in 1757, that is actually 20 years before independence of the country.
Okay.
So it's a very historic place where I work. Mm-hmm. So, and in fact, just for the record, still the old building where the hospital first started is still there, and then it's well maintained. So
okay.
I wish I could show a picture of that. I don't have it right now.
And we wish we could see that, but it's indeed a great opportunity, you can say, and it is a great thing to work in such a auspicious and such a big hospital. And like you said, that it still exists. So it feels very proud that you are a part of that hospital.
Indeed, it's my first actually proper job in the country, and to be working in that very first hospital that was established, it makes it even more special, at least, from a historic perspective.
Okay. Yep. So, Mannan, we also heard about that top 100 Powerless. So, what is it all about? We would also like to know, and our viewers are also excited to know about that.
Thank you so much. So, actually, this is called the Trailblazers 100 Powerless, which is actually published by a magazine that is published from UK, so which is called The Pathologist. So every year they publish a list of 100 pathologists which they think have made some impact in the field of pathology in various aspects. So, I mean, they have some different criteria how they go through. So I think that is it all about.
All right. Yeah. So that is it all about. And what do you think was your most significant that made you through this?
Well, it's hard to say what exactly is the factor, but of course, I'm humbled and it's an honor to be in that list where many of my mentors are also there. So what I can think of is that maybe going by what they have written in their website is that I am part of some of the online pathology educational initiatives, and in fact, I'm one of the co-founders of an online educational initiative called Pathcast, which is making a lot of impact in the field of pathology education. Maybe that is one of it. I'm not very sure exactly.
Okay, so you were talking about a Pathcast. So what is it all about? Our viewers also would like to know about.
No, thanks for asking that question. Actually, I'm very passionate about Pathcast. So if you go by the word per se, so Pathcast is the combination of two words. So that is pathology and broadcast.
Okay.
So as it makes so simple that by this platform, what we do is we broadcast live pathology lectures.
Okay.
And these lectures are available free for the viewers across the world. So that is Pathcast actually.
Okay, so that is Pat. So how do you arrange these kind of sessions, and like how is it available? So what is the procedure like if anyone wants to go through it?
Right. That's a very good question. Yeah, basically what we do is we invite a very eminent pathologist who is in any part of the world, but mostly they are in the US in any of the major centers there. So we invite them for a 1-hour lecture in their field of interest. So what we do before the lecture happens, we publicize the event on social media like Twitter or Facebook that this lecture is going to happen on such and such date.
Okay.
And on that particular date, the speaker can be anywhere. So he can sit in his office and we connect with the speaker. And then it's an hour-long lecture on a topic of pathology. And that lecture, actually, we broadcast live on both Facebook as well as YouTube.
Okay.
And viewers from across the world can have access to these lectures live, and they can even interact with the speaker.
Okay, so you get live questions also.
Yeah, you get live questions also, and then it is absolutely free for everybody. You just need to log in on your Facebook account, or if somebody doesn't have Facebook, can also go for YouTube to view these lectures live. And in fact, many a times we even had patients who knew that there was something related to their ailment. So they were even there and asking questions, and the speaker was happy to answer.
So that shows like how eager people are, how eager viewers are to know things and know new things about it. As you have also mentioned that patients also asking questions. So they also want to know that what exactly is happening, and they also want to be a part of the session. So how does it feel that when you get a good response from these kind of sessions?
It's actually, it's a very humbling feeling and very fulfilling at the same time, because I co-founded this online lecture series in 2016 with a very good friend of mine who is now an associate clinician in Mass General Hospital, that is part of Harvard right now. So when we see that we have audience which is from remote parts of the world, and then they are participating in the live discussions, so it feels very fulfilling, because one of our goal, the main goal that we wanted these sessions to be, that there is always a knowledge gap, right, between the resource poor places in the world and resource rich places like the West or those countries. So basically that way, in fact, the patient care also suffers. So through these lectures, we wanted to have a small effort towards bridging that knowledge gap. So, so when we see people from different parts of the world, like we have sometimes like, somebody watching from Myanmar, because when I am in New York and I see that somebody is watching from Myanmar or somebody is watching from Zambia, so it gives a very fulfilling experience that really we are being able to at least reach out to people in different parts of the world.
So do you think that it is putting an impact on the people, fully impact on the people?
Well, I cannot say people per se, but I would say that for sure that there is more and more popularity among pathologists. Because there are a lot of recent advances going on in the field of pathology as well. And those people who are in remote parts, if they can access to some of the recent advances through these lectures, so I think it is good. And when we see the popularity, like we have a Facebook page, we have a Twitter account, and we also have a YouTube channel, and together we have follower of about more than 10,000 people from across the world, and in fact around 140 countries. So that is very good to hear. And in fact, each of our lecture has an average view of about 3,000 to 4,000 views for each lecture.
So that gives indeed an immense pleasure, like when you see such kind of good response from the people. So talking about now state, Assam. So how is it relevant in Assam? So let's talk about Pathcast in Assam.
Right, that's a very good question indeed. And in fact, there are many viewers who are actually watching these lectures from Pathcast. I am very much in touch with the pathology community in Assam and in Northeast. So whenever there is a lecture, I also post that there is a lecture coming up in Assam related, Northeast related WhatsApp groups especially. So they are aware of it too. And many a times I see that there are, viewers in Assam. And coming to its relevance, of course, it is very much relevant, because this is one reason why Pathcast was so close to my heart, because coming from Assam, I know that in Assam Medical College, where I went for my medical school, so we do not have so much of access to world-class books or literature or all the recent technologies which are there. And of course, things have changed a lot in Assam, but still we have a lot to go as far as bracing up with the recent advances in modern medicine.
Absolutely, like every day is a new study, every day things advances, and like if you're talking about the technologies, it's advancing every day, and things are also upgrading, so all the studies are also upgrading as well. So you guys have to do a lot of like research as well, isn't it, doctor?
That is true, that's true. So that way I think if the pathologists in Assam who are supposed today just through podcast, they are being able to listen to some of the world's renowned experts, which they have read books or chapters, and now they can watch them live, or even they can ask them questions directly. I think it's a very fulfilling experience for them, and in a way, those teachings they can even impart in their day-to-day practice, and definitely the patients here will also benefit in the long run because of knowing there are some things which you can apply into practice without, not much of modern new technologies. So that way we can actually impact the people here as well.
And messages should be passed on to each and every one so that they can be upgraded with things or what exactly is happening in day-to-day life, isn't it? So talking about pathologies, like what do you think, what is the relevance in this modern society?
Right. That's a very good question. And actually, pathology is always very, very relevant in modern medicine or, modern day society, as you can say. And as you know, that pathology is the study of disease. So, and that way, so it forms the cornerstone of all medical fields or diseases. So it's somewhat similar to radiology, you can say that way. Majority of the medicine specialists or the surgeons, they rely on the pathologists to give the final diagnosis. And in fact, there is just jokingly, it is often said that the pathologists are the doctors because, you have a doctor who is waiting for your report. So you directly report to another doctor.
Because they can't take a call unless and until you get a green signal from the pathologist.
Exactly. So that way the pathologists are very much relevant, and they often work behind the scene, but being behind the scene, one is actually playing
a major
role in patients' diagnosis and future treatment, and that's more relevant in patients who are suffering from cancer, for example. And I would say that, in fact, because the final diagnosis always rests with the pathologist, like even though, someone can suspect initially that there might be a tumor somewhere, but till there is a report from the pathologist, the treatment cannot be started. In fact, there is a very famous novel by Arthur Haley, which is called The Final Diagnosis, where, the whole story is about how final diagnosis changes someone's life. So it's very relevant, and there are a lot of changes in modern medicine that is going on, and in all these changes, pathology plays a big role. So it's really very relevant.
Like Dr. Rifat, like if we talk about the authenticity and also talking about the authentication, like pathologists, like we see in every corner, like it's like a nook and corner we see a pathologist. So what do you think, like how, what kind of trust people will have, like if they go to one pathologist and they don't get a good response, or they don't get a exact results what they wanted to get, or so they again go to some other pathologist. So do you think shifting or the authentication, and what about the trust? Is it losing, or how to gain those trust?
Right, I think that's a very, very relevant question. So shopping, if you say that if somebody, especially from patient's point of view, if somebody goes about shopping from one lab to another, that's not a very good trend. And sometimes this is very important from a patient's perspective, that to choose the right lab is very important. And at least in every city, in every place, so there are some good labs. So which definitely it is sometimes hard to know, but the doctor that someone is going to, or suppose my doctor is so and so, at least he is the best person to guide to the right pathology lab. But one can, also use one's own judgment to go to one lab. So it is better to go to one lab rather than, doing some shopping around, because that also affects the results as well.
And it creates a lot of confusion, which to choose and which not to choose. So always, I think, should hear to your doctors, whatever suggestions is being given by them. Of course, you have your own sense of humor that, or you can understand where to go, because nowadays internet plays a very important role and you have a lot of information there. So you get a lot of confusion as well. So, but a good, a correct person will give you a correct path to choose it.
Right, right. That's why I think public awareness is very important, that a good pathology result is very important for diagnosis and future management. So that way, like one has to choose the pathologist properly, and one should think that pathologist is your best friend, so choose him wise.
All right. Now, Dr. Lai, what can we do about public awareness about cancer to the related?
Right, right. So actually, that's a very relevant question. I think there needs to be a lot to be done about raising public awareness about cancer. And I think there are many factors which needs to be taken into account. For example, first thing about lifestyle and food habits. We are all aware of the adverse effects of smoking and alcohol. So this is related to so many different types of cancer. You name it, you have it. For example, the cancers of esophagus, like which is the food pipe, or cancers of the lung, or cancers of different parts of the gastrointestinal tract. So many are related to esophagus and alcohol intake. So that is like food habit, lifestyle is important. And at the same time, about some other stuff, like which is more relevant to Northeast India and Assam. So what are we eating? Is there something to do with betel nuts? Of course, there are research about relation of betel nut with many, because it's also a type of tobacco. So how it is related to some types of cancer, and I mean more research maybe needs to be done. And some other stuff, for example, we do not know what's the role of tea. We have always been drinking tea a lot. So is it having a role in different types of cancer in our part of the world? And another awareness that needs to be there is about having an awareness about early cancer symptoms.
Okay.
For example, what are the main cancers that are prevalent in this part of the world? Cancers of the throat, cancers of the esophagus, that is the food pipe, cancers of lung, cancers of prostate are quite prevalent in this part of the world. And of course, not to talk about breast and uterine cervix. So early symptoms, nowadays there is no dearth of social media. There needs to be an awareness about what are the early symptoms. For example, for breast cancer, so after certain age, someone can do breast self-examination to look for any suspicious swelling or things like that. And immediately, if something like that is seen, one should go visit a surgeon or a local physician.
Right, should not hesitate, but also always go to your doctor and should talk to others as well.
Yes, because that's the main problem here, is that many of the cancers in this part of the world, like in our part, is detected very late. For example, breast cancer is becoming less and less prevalent in the West, because those cancers are detected very early. But here, breast cancer is detected late because we do not have the awareness to detect them early. So those are the things that are, I think, quite important. And from the physician's point of view also, like maybe there should be some more screening. For example, to reduce cervical cancer. So there is something called Pap test. In the West, Pap test is mandatory after certain years of age, but we still do not have it as a mandatory test. But I think we should offer patients Pap smear, ladies who are after 40, or mammography for breast cancer detection. So things like that. I know on a larger scale it is difficult to do, but whenever possible.
But at least early detection and early signs and symptoms if you get, you should not ignore, and you should immediately put an action on that, and you should immediately go for a diagnosis.
Right. And cancer treatment is quite same all over the world. But the only problem why in India or this part of the world, I think mortality, like the people die more from cancer, because the diagnosis is late. If the cancer is diagnosed early, early symptoms can be treated very quickly, and I think we are very good in treating cancer and as par with anywhere in the world.
All right. So talking about other types of cancers, like signs and symptoms. So immediately the patient or immediately the person who is finding some signs and symptoms should immediately go and have a checkup, isn't it?
Right.
So
exactly.
Can that person opt for the test himself or herself, or they have to go and see a doctor first, and the doctor suggests them to go to a pathologist for this test, and then the things will be worked out.
Right, right. The second approach is better. I would
approach.
never suggest that somebody should Google and find a test and ask for that test. I would say that please stay away from that kind, because when we are so much exposed to social media and internet, so we go to Dr. Google more than visiting a physician. So please, we should visit physician first whenever there is some alarming symptoms. That's why there should be an awareness about what are the early signs. Unless the patient knows what are the early signs of one particular cancer, how will they even go to a doctor?
Right.
So there should be an awareness more about that. So definitely one should go to the doctor, and then the doctor can prescribe, what to do at that time. And from a doctor's point of view, I think there should be a lower threshold to test for cancers. Like, say for example, stomach cancers are quite common in this part of the world, and many a times, so patient complains of vague symptoms about stomach pain and stuff like that, and it goes on for quite some time. So, if those need to be detected early, like for example stomach cancer, so an endoscopy is the best. And then when you do an endoscopy, you can do a biopsy. So those kind of things, maybe there can be a lower threshold to do those tests early on, so that we can detect such cancers early. For example, in the West nowadays, so every person who is over the age of 45 should do an annual colonoscopic examination. So that you can detect early colon cancers, because colon cancers are very well treated. So those kind of stuff we can do here as well. So that type of an awareness is important.
That's what proper awareness is very important, because here we see, or in our country we see that unless and until we have found any kind of disease, then only we go for a test, and then only we go for routine checkup is not in the dictionary of our people. So what is the thing is nowadays awareness, and nowadays we have to keep a lot of care for our health, because life have become fast and things have changed, and nowadays it's a thing like competitions have come out. So people have said that I have a lot of stress, I have a lot of depression. So this is one kind of things people have in their mouth, and they always talk about it. So what do you think, stress, depression, is it something can be loosened down, and how things can be worked out on that?
I think that's a very relevant question, and things I believe have changed a lot regarding annual examination, and people are quite aware that I feel even in Assam, I'm not saying even in Assam, in where there was not much of a culture of doing annual physical tests, but I think things are changing in that direction. But what are we doing about people who are living in the remote villages? So are we doing anything for them? So do they do a regular health checkup when they do not have any symptoms? Or people in the villages, do they know that after certain years they should do a pap test, or they should do test for breast cancer and things like that? For that, you will of course need more of an organized approach, right? For people who are more savvy, who have exposure to internet or social media, so they are more aware of going to the doctor annually. But if you want to reach out to the masses, then I think we will need to have more organized effort, where healthcare provider has to be more involved. And coming to your question about stress, so I think definitely stress, anxiety has a lot of role to play. And I recently had a conversation with one of my psychiatrist friends in Assam. So she was actually saying that stress and spread of cancer, there has been a lot of research about the role of stress in very different types of diseases. So it's very relevant. So stress, anxiety, those should not be downplayed. And with today's lifestyle, so we are so much prone to stress, anxiety, depression. So they need to be treated. So they are so easily treatable. If there is a stress or anxiety, one should definitely go to the, to your closest psychiatrist who would be able to help.
And the important role is being played by the family members, and the love and affection which you get from your family members, that gives you an immense, the best medicine to cure whatever your stress or whatever depression you are going through. And doctor, talking about that, how to reach those remotest persons to make them aware about the things, what is exactly happening. So that was my question, to you. You were saying that you have a conversation, and it's been telecasted live and people can watch it free. So what about those remote people, the ones who are not access and ones who are not access to internet, and now ones who are... So do you think that in near future you will also plan up to have those awareness camps, awareness meetings, or awareness those kind of rallies to make them aware? and you to reach to home, like information pass on, something like that?
That's a very important question. To be honest, like I mean, so right now, I do not see that I am actually doing that. I mean, whatever we are doing, I'm not saying me, like whatever we are doing is that we are just, broadcasting pathology lectures, right? And we are not even reaching out to the other parts of medicine. So what about the other branches of medicine? Because I'm a pathologist and my friend is a pathologist, so we have started with pathology. And in future, we really plan to broaden our, what's it called, reach. So maybe first reach out to the other branches of medicine and going to the remotest parts, as you said. So that is very serious, and I think that's quite important, where you cannot rely on internet and things like that. So then maybe there definitely has to be one needs to reach out personally, right? You have to have rallies, you have to have door-to-door campaigns. So
and nowadays we have seen those awareness camps have already started,
that's
and
really good.
It's a good initiative taken by the people. So Dr. Rifat, what would you like to tell our viewers of Good Life, and what message do you want to give to them so that they can lead a healthy life, and you give them a good message so that they will have a good day?
Yeah, I think my message for our viewers today is that, of course, that health is always your wealth, and I think there is a growing rise of different types of cancer in this part of India, and so we need to be aware of the early signs and symptoms of cancer. For that, there are so many different programs available. I think Bibirua Cancer Institute is also taking a lot of initiative in that regard. So yeah, be aware of early symptoms. Whenever there are early symptoms, for example, like any lump somewhere, any bleeding from somewhere, and if there is, for example, any difficulty in swallowing and things like that. So we need to go to the doctor quickly, and lifestyle related things. So we need to have a healthy lifestyle and have less maybe fried food, and stay away
Physical
from
activity,
physical
proper
activity,
diet.
stay away from smoking and alcohol as much as possible. So I think lifestyle is very important for a healthy life. So that's what I would say to our viewers today.
All right. I'm sure the viewers who have just watched our discussion right now must be fruitful with the discussion we had right now. Thank you so much, Dr. Rifat Mannan, for having this proper and a very fruitful conversation on this pathology. And indeed, I'm sure that viewers must have watched it and have benefited with whatever the conversation we had today.
Thank you so much. Thank you, everyone. And thanks for having me here.
Thank you so much.
Thank you.